I'm Dr. Pai and this is Dr. Madhuri Patel, and we are going to be talking about quality of care and how interpartum focus on improving care can overall improve the quality of care. And I would like to start this discussion by asking a question to Dr. Abha Singh. Abha, what are some of the best practices that private sector can adopt to improve the quality of care?
Thank you, Dr. Pai. The quality of care should include, should be mother-centric, and this will ensure the mother's needs, preferences and dignity are respected. The facility should be prepared for any, the hospital and the healthcare center should be equipped to handle any maternal and newborn emergencies. The care should be equitable, safe and efficient. Then services should be effective. They should be following the evidence-based practices. Then respectful maternity care is essential, which includes upholding the dignity of the mother, autonomy and respect the patient's rights. Then standard operating procedures should be in place, and so that the consistency and the quality of the service is maintained. Then integration among different hospital departments should be there, so that whenever you require healthcare facility from other specialities, it is readily available. Teamwork should be there. If you require any help, the other medical professionals are also available for a better patient outcome. Then the communication should be very clear between the doctor, the patient, the attendant and between the healthcare providers. Sufficient human resources should be available. Say you require blood, so you have to rush one person to bring the blood or to call a doctor, so you have to have enough human resources. Then documentation of whatever things you have given to the patient, like IV drugs or sedation or IV fluids should be there. The medical history should also be written properly. Then if you want to refer the patient, the referral should be also proper, and it ensures that the patient will receive specialized care whenever it is required. Then audit is very important part of the healthcare system, and it will help in improving the healthcare facility, the quality, and ensure continuous learning and development of that department.
Thank you, Dr. Abha. Now my other question is to Dr. Shamal. Can you elaborate on some of the tools that can be implemented during intrapartum care to improve quality of care?
Yes, thank you, madam. I think this is the most important aspect of any pregnancy and childbirth procedure. Basically, these are meant to monitor the progress of the labor and childbirth, and so that one is capable of early detection of any adverse labor complications and efficient and proper timing to intervene the procedure or labor progress there. That is the most important aspect of labor monitoring and childbirth. Now, whether we call it a tool or a process or method, since our age-old days we know that we monitor labor mainly by noting the cervical dilatation, and that age-old formula of 1 centimeter per hour dilatation is good enough still today during the active phase of labor, not the latent phase. And the main purpose of this, that you can cut off or you can take some active method when you find that yes, progress is not that satisfactory. Now then came the concept of partograph as conceptualized by Philpott and Castle. Now partograph is a graphical tool representation of the duration of labor in hours in x-axis and cervical dilatation in centimeter in y-axis to monitor the progress of labor, whether it is satisfactory or not. And the most important aspect is that the partogram contains two lines. One is alert line, another is action line. And if you find that the curve, that sigmoid curve is not up to the satisfaction level, then you can intervene or you can take some, say, like augmentation of labor kind of things. And then came the concept of active management of labor, proposed by O'Driscoll and his colleagues. And there it is that to identify those women which could be identified that yes, progress of the labor is not that satisfactory at the rate of 1 centimeter dilatation per hour. So we can identify those ladies so that at least we can reduce the number of the ladies who are having slow progress of labor. And then the latest is our WHO came with the labor care guideline with so many advanced methods, advanced technologies to identify the progress of the labor. So these are the tools we still today practice depending upon the which kind of hospital we are attached to.
Great, Dr. Shamal, you have done a fantastic job on throwing light on all these aspects. Dr. Komal Chavan, I would like to ask, continuing where Shamal said left about labor care guide, can you elaborate on the labor care guide and also when should it be initiated and where should labor care guide be used?
Yes, thank you, Dr. Pai. Labor care guidelines have 7 essential segments. So the first very important is identifying the information and how is the condition of the patient at time of admission. It is very important because when the patient is admitted, we know what are the baseline parameters. What is the stage of the labor, what is the condition of the patient when she is coming for admission. Then the second important is the supportive care. The mother who comes, there is a lot of anxiety. So comforting that mother, the anxiety quotient also should be reduced, and that will give her a very good experience of the childbirth and labor. So the supportive care becomes a very important second aspect. Then care of the baby. The condition of the fetal well-being, the baby care should be documented and should be ensured that it is proper throughout the labor, and even the intrapartum period should be monitored very closely. Then care of the mother's condition is equally important. Her vital parameters should be regularly monitored. Her condition, if there are any medical problems, they need to be taken care. Then ensuring how is the labor progression, because the labor also needs to progress. We need to find out whether the dilatation is increasing efficiently, whether the contraction are good, or the baby's head is coming down very well. So labor progression needs to be documented, everything. Then medications, because some patients require medical augmentation for labor, pain relief or analgesics or other drugs which are given, they need to be given. They need to be even documented whenever they are administered to such patient. Then above all, the last and the most important is shared decision making. So whatever the healthcare provider gives to the patient, there should be an informed communication between the pregnant mother and the healthcare giver. It's very important because the patient is prepared what is going to be the course and what medication and how is the labor going to progress. So this all 7 essential steps are very, very important, and this all are aiming at a comprehensive, respectful and an individualized care which is given to every pregnant woman in labor.
Thank you, Dr. Komal. Such a very nicely you elaborated, and we know that only partogram, now we are shifting to the labor care guide, which includes many important points, especially consent of the patient, explaining the patient that what you need and what we are supposed to do, and the patient consent also is very, very important. Now coming to Dr. Apurva, how to ensure systematic and consistent application of labor care guide.
Thank you, ma'am. Essentially, there are 4 steps when we are talking about labor care guide: awareness, training, integration into the hospital records, and real-time monitoring. So when we talk about awareness, especially in the private sectors, it's extremely important that we create awareness of a systemized and protocol-based labor care guide, not just with obstetricians and gynecologists, but also with nursing staff, midwives, and even paramedical staff as well. It's important that they know what we are doing and why we are doing. So emphasizing on a structural and evidence-based labor monitoring is important for all the members of the team to understand. The second parameter is training. Of course, we can have so much of discussions and, we can have so much of understanding between us. But unless we continue the training, why do we keep having CMEs? Because we want to continue the training that we've had in our MD days. Similarly, even for LCG, that is your labor care guide also, it's important that all the team members are aware and continue to kind of understand what are the advances that are happening and what are the protocols that we are following, because this will help us in monitoring our patients better during the process of labor. Now, integration of this LCG into the hospital records, whatever parameters that we are seeing or monitoring, unless we kind of document it on paper, it is not going to have any value, because one, we might be monitoring multiple patients, we won't know that exactly what are the factors that we are looking, either the basal heart rate of the baby, on the CTG, what are the accelerations that we are seeing, are there any early decelerations that are there, even including the heart rate of the mother, blood pressure, there are so many parameters that are there. So it's not possible for us to kind of remember all of these things. So it's important that we integrate it in our case sheets, wherein we are able to document these progress or changes that are happening during the process of labor. And the fourth most important factor is real-time monitoring. If we see a patient at 10 a.m., 11 a.m. or 12 p.m., if we do not enter the details of what we have seen for the patient at the exact same time and retrospectively enter those details maybe 6 hours, 12 hours or even worse after a mishap has happened, if we go ahead and retrogradely enter those details, that is not going to add any value to our monitoring. So it's important that at any given point when we are seeing a patient, any medication that we are administering to the patient or any progress that we kind of notice in the patient, it's extremely important that we kind of integrate it in the same time, so that we have an understanding as to how the patient is progressing during the labor, and at the same time it also gives an insight of the patient's progress to any other healthcare providers who are kind of coming and monitoring the patient in a subsequent fashion. So I think these 4 steps of awareness, continuous training, integration of the LCGR in our hospital records, and of course real-time monitoring is very important as a part of monitoring our labor patients.
Great, Apurva. I think you have really thrown a good light on the 4 steps, and I would like to now ask Dr. Pragya, can you elaborate on the part of respectful maternity care which plays in this spectrum of quality of care during childbirth?
Thank you, Dr. Pai, for the question. Now, respectful maternal care is something which has been often neglected in a lot of settings, and that is why WHO has identified this aspect, respectful maternal care, as an important component of the spectrum of quality of care during childbirth. So, respectful maternal care ensures that women receive high quality care with dignity and compassion. And it has about 9 core principles, and I would elaborate upon them one by one in simple words. Like the first one is dignified care. And what does that mean? That every woman should be treated with respect regardless of a background, social status or medical condition. So which means that we have to treat all women with a lot of dignity. Now the second principle is consented care, which means that women must be fully informed about all medical procedures which are being carried out during the intrapartum period, and the consent should always be obtained before any intervention. We should not embark upon any procedure, be it simple or complicated, without explaining the pros and cons to the patient. Now the third principle is confidential care. Now what does that mean? It means protecting the privacy of women during labor and delivery, which is very crucial for maintaining trust and ensuring a positive birth experience. Now many a times confidential care has not been given that much of importance, especially in the Indian subcontinent. The fourth principle is non-abandonment in care. So what does that mean? Which means, we should not just leave any lady who's in labor alone. That should not be done, because many a times they are just left to labor on their own. So that practice should be left, and we should practice non-abandonment in care. Now the fifth principle is no physical abuse. So which means that any form of mistreatment, coercion or physical abuse is unacceptable in maternal care settings. So no woman should be physically abused in labor. Now, no abuse related to cost. What does that mean? Well, even if there is disparity in the social status of the woman, she should not be abused because of the financial constraints that she is going through. So it should never lead to denied or compromised care for women during childbirth. Now the seventh principle is equity in access. So all women, regardless of socio-economic status, must have equal access to quality maternity care services. The eighth principle is cultural sensitivity, which means that we have to be very sensitive to all cultures. We have to have respect towards all cultures and women coming from different ethnic backgrounds. Then emotional support. Well, it cannot be overemphasized that it is the duty of the healthcare professionals to emotionally support laboring women. So pregnancy and childbirth are deeply emotional experiences. Empathy, reassurance and psychological support are essential for ensuring a positive maternal experience. So overall, we can sum up that by embracing respectful maternity care, we can create a safer, more supportive environment for women, ensuring that childbirth is not just a medical experience, but a dignified and empowering journey.
Thank you, Dr. Pragna. You have really elaborated this respectful maternity care. Let me say that our maternal mortality rate of our India nation is 97 per 100,000 live birth, and almost 95% of our women are delivering in institution. It can be a public institute or a private institute. So the respectful maternity care, respectful maternal care really plays important role. If they have a positive birth experience, the word is going to spread in the community. Yes, we went to the institute and we had a good experience. They are going to come to the institute for the second delivery. At the same time, they are going to motivate other neighbors and all. So we have to remember, if we have to have less maternal and perinatal morbidity and mortality, the women have to deliver in the institute, and for that, respectful maternity care, maternal care is very, very important. Well done, Dr. Pragna.
Thank you so much.
So my next question is Dr. Bhagya. How can the principles of respectful maternity care be extended to counseling and providing postpartum family planning services?
Thank you so much, madam, for the nice question. And I think this counseling for family planning actually should begin early in the antenatal period. So once they start coming for the antenatal checkups, from then actually they should be exposed to all the basket of contraceptive devices that would be available after the delivery. So they need little sensitization, because suddenly after delivery, if we start counseling them, it may not work that well. And we are all aware about the number of maternal mortalities that happen due to unwanted pregnancies. So then when we come across women after delivery, I think the contraceptive basket actually should be divided into two groups, in women who are actually going to breastfeed and the other group which are not. Because if she has intrauterine death or some problem where she is not actually going to breastfeed, then she would have a different kind of choices, like contraceptive implants and intrauterine devices can be offered, and that can be given immediately after childbirth. And female sterilization and male sterilization, of course, can also be offered if they are planning some kind of permanent contraception. Injectables such as Antara, which are 3-monthly injections, progestogen only pills and condoms can be started right after delivery. Combined oral contraceptive pills, which is available in the government setups as Mala N, these can only be introduced after 6 weeks once estrogen's impact on the postpartum recovery is considered. And emergency contraception should only be used in urgent situations and under medical supervision and should not be encouraged too much. But the other group in which the woman is planning for breastfeeding, the family planning choices are little different, and we have to consider its impact on lactation and the infant health. Here's what we can recommend them. Contraceptive implants again can be given, but then it needs a lot of counseling, because women think that they are being forced into having those intrauterine devices. And female sterilization can still be initiated immediately after childbirth, but then again I have to tell that, cannot overemphasize that it needs a lot of counseling, because when they are intrauterine devices are inserted and they continue to bleed for some time, after a month's time they'll go somewhere else and take that out. And injectable contraceptives again can only be given after 6 weeks postpartum. Progestogen only pills and condoms can be used as early as birth, but combined OC pills should be delayed until at least 6 months postpartum to avoid affecting breast milk production. And emergency contraceptive again is the last resort and last option, and should only be used under medical guidance. But for all this, the women needs a lot of counseling and need to understand the problems or maladies of unwanted pregnancies.
Thank you, Dr. Bhatia. Very well said. I would like to say there is a myth amongst the community that the lactation prevents pregnancy. It acts as a contraception. So as an obstetrician and gynecologist, we have to give the message to the community. Lactation does act as a contraceptive, but only 1.5 months. But after that, even she is lactating for 1 year or 2 years, they need a contraception to prevent unwanted pregnancy. So our community should do counseling to our patient when they are delivering. That is the best time to tell them these myths should be out and they should use good contraception.
I think Bhagya has really thrown a light, and even Foxy has got a postpartum IUCD program which we conducted very successfully, and we are sustaining that program. And I would now like to ask Dr. Varsha Baste, what are the essentials for preparedness for immediate newborn care? Varsha.
Thank you, Dr. Pai, for this really important question, because the Manyata checklist also tells us that the preparedness should be before the birth of the baby. There should be a corner in the labor room or a separate room just adjacent to the labor room, which is having preparedness for the newborn arrival. Like the baby doesn't tolerate hypothermia, so the temperature of the room or the corner should be around 22 to 25 degrees centigrade. There should be preparedness of these hot and humid gases. Then radiant warmer should be there, which will take care of the hypothermia or the thermogenic shock to the baby to be protected. There should be these special mattresses which will protect the baby from heat loss, polyurethane bags, caps that will protect the baby and keep it warm. Also, the checklist also tells us that there should be stethoscope available which will see the airway, whether the lungs are filled or not, the heart rate of the baby, and within half minute the baby's lungs should be filled with oxygenation with the extrauterine existence of the baby. That is very, very important. So thermal care and the oxygenation is utmost important for the baby's good survival afterwards. So the ambu bag and the airway should be there for assisted resuscitation of the baby, then stethoscope, then airway, then the clamp and the sterilized instruments which will avoid the infection occurring to the baby. If the mother is negative, then RH vials should be, the blood should be collected in special vials, then instruments should be sterilized to avoid infection. And also the vitamin K should be given to avoid the bleeding disorders, and then kangaroo medium maternal care is given to the baby which are less than 2.5 kgs. The staff should be very well trained for the resuscitation of the baby or the newborn baby care. And in case of need, the baby should be transferred immediately to the tertiary center or the NICU care. So it should be known to the nurses and of the staff when to shift the baby, and the baby should be kept as very, very precious thing, and every minute counts. So the preparedness is very, very important beforehand the baby is arrived or baby is delivered.
I think you said correctly, and neonatal care is very important, because if in the pregnancy the outcome is problematic, then it can really, all the effort that we have put in will go to waste. In fact, Foxy with Neonatal Forum has got a, you can, many of us can go for the neonatal resuscitation training program.
Yes.
Which can help.
The staff
us
training is very,
well.
very important.
A very
So the
important part
Manyata
of this.
checklist is also important for
Right.
us.
Right. So would you like to ask the next question?
Dr. Varsha, as Dr. Rishikesh said, that we have to train ourselves as an obstetrician for the neonatal care and resuscitation, because in a private sector, there are lack of neonatologists, and they may not come, or they may not come in time. So it is always better that we take proper neonatal care, resuscitation. This will definitely help our newborn babies also. So along with this, now we will come to Dr. Hara. What is the role of breastfeeding in neonatal care?
Thank you, Dr. Madhuri, for this very important question, because breastfeeding, it is told that it is nectar or amrit for the baby. It is a wholesome food which is available free of cost from the mother, and it works as a bondage between the mother and the child. Second thing is that breastfeeding should be initiated as early as possible. The moment the baby is delivered, put the baby on the lap or the chest of the mother with a skin-to-skin contact, so they can feel the bondage between mother and the child, and then you start put her mouth into the mother's breast, so that baby will start sucking. And they also say today that even the umbilical cord is not cut, you can initiate breastfeeding. So there are certain methods the hospital should adopt for breastfeeding. The first principle is that the hospital authority should promote a breastfeeding campaign. They say no to bottles, and this staff should be aware that they should promote every mother for breastfeeding rather than artificial or bottle feeding. Second thing, the staff should be competent. They should explain the mothers the benefit of the breastfeeding, how to breastfeed them, and that is more important. And this breastfeeding should be taught to the antenatal mother during their antenatal checkup or during the antenatal classes. This is the period, in the antenatal period, the breast should be checked whether there is a deepening or there is crack, there is fissure, there is inversion, so that it can be corrected before delivery and the mother is ready to breastfeed the baby. Second thing, I have already told that skin to skin contact is very essential. So for the mother to know that this is my baby, and the baby can feel that this is something my mother. And supplementing whenever it is necessary. See, if at all the baby is not able to take feeding, or there is contraindication to breastfeeding like HIV/AIDS or active tuberculosis, these are the conditions where you can supplement, not in other things. And the mother and the baby should be kept in one room together 24/7, so that the feeding will be competent. The responsive feeding, the mother should be encouraged to breastfeed babies in hunger cases. Earlier we were telling that give the baby breastfeeding every 2 hours, every 4 hours. This is now we say promote the concept that breastfeeding on demand. When the baby cries, the mother can know that the baby is hungry, she can feed her. That will actually stimulate the baby to suck more and more. And even if some of the people who are the baby cries, they put a teat in the mouth or a pacifier, that should never be encouraged. Rather, breastfeeding should be encouraged. And most of suppose somebody is not interested, or for some other reason is aversive to breastfeeding, these mothers should also be treated with respect. That you should not say that you are not breastfeeding your baby, you are not taking her. They should not be disrespected. They should, their opinion should be taken into consideration with respect what you are told, respectful maternity care, and then you can also give them supplementation. The benefit of breast milk. And the benefit of breast milk, I have already told that for the baby, it is a complete food and it is nutritious, it contains all the components with water and everything. Second thing is that it has got a lot of immunoglobulins in it. It prevents the baby from many infection, even ARDS and other things. So second thing is that it also works against infection. I have already told you. For the mother, if first and foremost, if the mother is exclusively breastfeeding, this will add for the involution of the uterus. Uterus will gradually contract and in 6 weeks time it will come to the normal position. Second thing is that you have already discussed that delays pregnancy. At least it can work as a contraceptive as long as exclusive breastfeeding is done. And moreover, it is seen that if the mother is feeding the baby with breast milk, there is a less chance of ovarian and breast cancer. This is a very important thing, and it also decreases mother's workload rightly. And rightly, it also saves money from artificial or tinned milk. You are giving the mother's own milk. And second thing is that it also promotes family planning. There is what you say, and there is a decreased need of hospitalization also, because the baby does not suffer so much and continues for child survival. So overall, we can say that breast milk is the best milk, and it is like a nectar or amrit for the baby, and all mothers after delivery should start breastfeeding the earliest the possible, and they should feed the baby with love and affection so that the baby will have a skin to skin contact and they have a happy bondage for all time to come.
Thank you, Dr. Hara. I totally agree with you that you have to examine during antenatal period, breast. As you mentioned, many times there are retracted nipple and you come to know only after delivery. That time it becomes little difficult for the mother. So antenatal examination of the breast is very, very important. Sometimes when they come with a colostrum during antenatal period, they are worried. What is happening? So you have to also counseling about that part. And what you mentioned that we say immediately breastfeeding. How immediate? You have really said that as soon as the baby is born, before even cutting the cord, if the mother is comfortable, one can give the breast to the baby. And secondly, what we talk about a golden hour, it is actually mother has to breastfeed the child just within 1 hour, which gives the maximum benefit. And you also said very nicely what are the advantages and disadvantages. And you also said that if the mother for some reason doesn't want to breastfeed, or she is suffering from infection, some disease, she doesn't want to breastfeed, we have to respect her decision. So that is very, very important part, and there are so many advantages of breastfeeding. It has to be talked to the mother as well as pregnant lady as well as the relative during antenatal period. So even in the house atmosphere, that is also very, very important. She is encouraged to breastfeed every time and not giving a top feed. Sometimes the mother gets tired, she is so much of tired after delivery, and every 2 hours she has to get up whenever the baby cries, has to give the breastfeed. So at least rest of the time when the baby is sleeping, in the family also they should allow the mother to take rest. So that is also very, very important part. So we have to also involve family as far as the breastfeeding is also concerned. So we had a very good discussion, and I would like to conclude that quality of care provides holistic approach to strengthen maternal and newborn health services, ensuring that every mother and baby receives high quality, respectful and effective care, so to give the very, very positive birth experience and healthy baby and the healthy mother to the family, community, nation. That is our child is going to be future generation, and we want our nation to grow. So thank you all, dear friend Dr. Rishikesh, my co-moderator, and my panelists for doing excellent work. And of course, we should thank Dr. Jaideep and team for giving us this opportunity. Thank you all of you for the patient hearing.